Cosmetic doctors can be really stupid. There are a lot of absolutely dumb cosmetic treatments being performed today by doctors all across the country. I have no idea why they continue to do these treatments, probably just to make money, but either they don't work, they just have never worked, or maybe they have a high risk of complications. I'm going to count down 5 of the dumbest cosmetic treatments being performed today that I recommend that you avoid. You may have seen videos of carboxytherapy on TikTok or other social media platforms, and these videos look pretty scary. Carboxytherapy is a treatment where you take a canister of carbon dioxide gas, you attach it to a tube or a hose, and that eventually goes into basically a needle. You stick that needle underneath a person's skin, and then you turn that carbon dioxide gas on, and it pushes CO2 gas underneath the skin. Now, the belief with this treatment is that by adding CO2 to the skin, it can cause oxygen then as a reaction to accumulate in that area. And by increasing the oxygenation to those tissues, you can rejuvenate them. And there are doctors and other healthcare practitioners who claim that carboxytherapy can do anything from improving wrinkles to improving cellulite to even improving the function of the body. But the fact is that there are absolutely no studies, 0 studies showing that carboxytherapy is beneficial. Now, although this treatment is admittedly very scary looking, I'll tell you, the reason why it's number 5 on the list and not number 1 is that it does not appear to be dangerous. As scary as it may look at these people getting their eyes just absolutely puffed out with the CO2 gas, other than maybe stretching the skin out a bit, there does not appear to be any major complications that have been associated with carboxytherapy. But that being said, I still don't recommend it because there's no proof that it does anything, and so essentially you're spending a bunch of money to puff out these parts of your face or your other parts of your body with probably no benefit at all. Do you want your eyes to look like the eyes of a fox? Well, this is a trend that's been going all over social media. You can see videos like the ones that I have playing right here of somebody getting a fox eye lift. Now, a fox eye lift can be done either surgically or it can be done using threads. When it's done surgically, it's called a canthopexy. And what we essentially do is we detach the end or the side of your eyelid. This is called the canthus, and we can reattach the canthus in a higher position. Now, it is rumored that certain celebrities may have had this procedure done, including Bella Hadid. Well, another way to perform a fox eye lift is using barbed sutures. And these are sutures that basically have tiny little cuts made in them so that when you actually run them underneath the skin, those little barbs or those cuts in the sutures can actually grab onto the tissues and cause it to be temporarily lifted. Now, the problem that I have with this operation is not that it can create horrible complications, which it can create complications like scar tissue and even deformity, but that this procedure is quite expensive. It can cost them many thousands of dollars, and the studies that looked at barbed sutures show that the results only last maybe 6 to 12 months at the most. So would you pay $3,000 to have your eyelids lifted for 6 months? Most of my patients would say definitely not. And my guess is that you may not hear a whole lot more about fox eye lifts 6 to 12 months from now when the ones that are being done now basically wear off and people realize that it was a waste of their money. I have so many patients ask me, "Doctor, why don't you inject a permanent filler? I don't like coming back every year or two to have filler injected." And some people even believe that the reason why we don't often use permanent fillers as physicians is because we want to make the money of somebody continuing to come back. Well, the truth is that permanent fillers can cause permanent problems. And what I mean by that is that you can have a permanent filler injected, like let's say silicone, and it may look and feel pretty good for a while, but there are people who find that 2, 3, 5, 7, even 10 years later, you can get complications from permanent fillers. Some of these complications can include late onset infection, where you can get literally tracks from the filler out to the skin where the skin erupts in pus.
Pus?
You can get granulation tissue and inflammation around that filler, causing that filler to turn into a hard lump. Or you can even get migration of the filler as well. Or you can even get filler that seems to enlarge due to a combination of both. Now the problem with permanent filler is that if you want to have it removed, the only way in general to effectively remove it is to cut it out. And that can create major deformities. So for example, I had a patient that once came to see me who had permanent filler injected under her eyes. This wasn't a silicone, but it was actually a permanent filler that is FDA approved. A nurse in a close by suburb injected this under my patient's eyes, and initially it looked fine, but about 6 months later it started to harden into little nodules. And within about a year, those nodules became bigger and very visible. So she came to see me to see what I could do about it, and honestly the only thing I could recommend is going in and actually cutting those nodules out. So this is a very difficult problem that people who have permanent fillers have to deal with, and sometimes there just is no good solution. So if you're thinking about getting fillers, I encourage you, stick with hyaluronic acid-based fillers like Restylane or Juvederm. The good thing about these fillers is that they are reversible. We have a reversal agent called hyaluronidase that we can inject into those fillers in case they become lumpy or you don't like it, to basically melt that filler away. This is going to really upset some of my friends in the holistic space because IV therapies are a big business in holistic medicine. Doctors, nurses, and other healthcare providers are putting IVs into people and infusing them with different vitamins and hydration and who knows what to try to improve their health. And the idea kind of makes sense. You know, if you want to get these nutrients into the body, you can do it very directly using an IV. However, my main issue is not that IVs may be beneficial for some people, but it's that you are damaging the vein every time you put an IV into it. You will get scar tissue to heal the trauma from that needle going into that vein. And we know that as we age, there's a greater tendency for us to need to go to the hospital for a medical condition and be treated using IVs. As somebody who spent 3 years training in general and trauma surgery, I know that there are instances that we have a hard time finding IV access in patients, especially as they get older and if they've used a lot of IVs in the past. So my big question is if you're getting IV therapy when you're younger and you don't need it, are you potentially damaging those veins that could be used for actual medical treatments in the future? Are you going to get to a point where you need an IV when you're a bit older and the nurses and doctors can't find a suitable vein to put it in, and so they have to put in a central line? Well, a central line is an IV basically placed through one of the large veins of the body, whether it's in the neck, in the chest, or in the groin. These are not fun to have put in, and they can be potentially risky. So unless your IV therapy has a definite benefit that you need, I really would encourage you to think twice about getting IV therapy. Could you be using your veins now when you don't need them so much for something that's not all that necessary, and then not have those veins be usable when you truly need them in the future? These vampire treatments are absolutely stupid. Now, many years ago, when platelet-rich plasma was just being introduced, I was interviewed by the New York Times on my thoughts on the vampire facial or the vampire facelift. And at the time, this was kind of a slang term being given to using any type of platelet-rich plasma to inject, let's say, into nasolabial folds, underneath the skin, or as an onlay. Platelet-rich plasma is when you draw a person's blood, you spin it down and remove the platelets, which are chock full of growth factors. And there's a belief that by injecting that platelet-rich plasma into different parts of the body, it can improve both its form and its function. Well, after the vampire term was being used to basically describe all different uses of PRP, whether it's to inject into the breasts, into wrinkles of the face, or even as an onlay for, let's say, after microneedling, a doctor actually took a trademark on the vampire pretty much everything, ranging from vampire facelift to vampire facial to vampire breast lift and God knows what. And several years after that New York Times article was published, he even sent me a threatening letter threatening to sue me because I used the vampire facial or vampire facelift or whatever in that New York Times article and commented on it. I don't know if he was jealous that they interviewed me and not him, who knows? Well, the fact is, I actually looked up the information and he actually took the trademark on the vampire name years after this New York Times article came out. Now, this is my opinion, and I'm going to say this for legal purposes. This is my opinion and my opinion only, but these treatments in general do not work. I think PRP can be great when you add it as an onlay after microneedling. There is proof that if you inject it into the scalp, you can help hair to regrow. But to use PRP and inject it, let's say, into the breasts to say that it's going to lift or perk up the breasts is absolutely false. It will not do that. To inject PRP as a filler into the face does not work. I tried it, it doesn't work. And the jury is still out, in my opinion, of whether injecting PRP into the private areas can enhance a person's intimate experience. Well, years ago, vampires were really hot in the media, and so this term has been used for these treatments because you're using your own blood. But honestly, the whole thing I think is absolutely stupid. But I do think PRP can be used selectively for certain effective treatments. So in my opinion, these are some of the dumbest cosmetic treatments being performed today, but there are some treatments being performed that may not be dumb, but they are way, way out there. Have you heard of the G-shot? No, not the G-spot, the G-shot. Well, take a peek at this video right up here, and I will explain to you what the G-shot is and what some of these strangest plastic surgeries you may or may not have heard of are as well. And remember, eat real food, use clean skincare, and always auto-juvenate before you operate.